So welcome everyone, and thank you for joining us this afternoon. Wisconsin Early Childhood Association is excited to welcome you to the Raising Wisconsin panel discussion on community efforts to support childcare. I'm Ruth Schmidt, WECA's Executive Director. It is fitting that today's event is taking place on a local election day in Wisconsin and during the National Week of the Young Child, which is an annual time to recognize the impact that childcare and early childhood professionals have on children, families, and our communities. It also comes just one day after the official launch of Raising Wisconsin, a bold public policy initiative built off of WECA's long-standing successful advocacy efforts. Raising Wisconsin is advocating for transformational change in early care and education and optimal child health and well-being. At WECA, we continue to observe more and more local leaders recognizing the importance of high-quality, affordable, and accessible childcare for supporting healthy children and a healthy community and economy. At the same time, we also have observed more and more communities coming together to develop solutions to help address some of the immediate pressing needs of their local childcare infrastructure. Our hope is that you come away from this event today energized about the opportunities available for addressing local childcare access and affordability as we continue to push for systemic change and long-term sustainable solutions. After the panel discussion portion of the event today, we will share more about the new Raising Wisconsin website, which is a vehicle for sharing your stories and experiences to advocate for meaningful change with policymakers and legislators. And now I'm going to turn it over to my colleague, Paula Drew, co-director of the Wisconsin Early Education Shared Services Network, who will be serving as moderator of today's panel. Paula?
Thanks, Ruth. I'm honored to moderate this discussion today. We're joined by 4 Wisconsin changemakers impacting the early care and education sector in their local communities. Marianne Torkelson is the chair of the Jackson County Childcare Network. Daria Hall is the Early Childhood Education Director at Milwaukee Ece. Nina Hutton is the director of the Clubhouse Childcare Center in Amery, Wisconsin. And Tina Crave is president and CEO of the Greater Watertown Community Health Foundation. Throughout the course of today's discussion, you'll have the opportunity to learn about the impactful work each of our panelists have been engaged within in their respective communities. But before we dive into the discussion, we'd like to learn a little bit more about who's in the virtual room with us. We have 2 brief polls for you to complete. We'd love to first hear about your background to give us perspective on what prompted you to join today's event. And a second, to learn what region of the state you are from. Here's our first poll. You can't actually see the results come in, so I don't know, but I'm guessing we're almost ready. And I think that we'll then get to see the results so everybody can learn who else is here with you. Okay, so it seems like we have a lot of early educators in the room and a lot of advocates, as well as county, municipality, and state employees, employers, community leaders. We have a nice mix of folks attending the session today. Thank you so much. Next, we're just going to learn a little bit about what parts of the state you're from, so that can help our panelists in answering the questions. And survey says 50% of folks are from the southern region, 22% are southeastern, and northern, northeastern, and western are sort of like evenly mixed between 5 and 15%. So a really nice mix of the state, which is excellent. We are so delighted to be here with you all today, and our panelists. We are excited to hear their stories. So we're excited to hear what they have achieved locally to stabilize and grow childcare in Wisconsin. First, we will hear from Marianne Torkelson, who is the chair of the Jackson County Childcare Network. Jackson is a rural county in western Wisconsin, whose county seat, Black River Falls, has roughly 3,600 residents. Marianne, please start off by telling us how Jackson County's efforts began, with particular focus on how you've rallied support from the community and key community leaders to begin the task force, and how you've kept people engaged throughout your 4-year journey.
Certainly. Thank you, Paula. And thank you for the opportunity to speak with everyone today. As Paula said, Jackson County is a rural county. We're about an hour south of Eau Claire and about an hour north of La Crosse. Our total population in our county runs about 19 to 20,000, and Black River Falls is the largest community in Jackson County with a population of about 3,600. So we're very rural in nature. And our work in childcare started with a lobby conversation. I work at Co-op Credit Union, and the manager of the electric cooperative was in one day in the lobby speaking with our president and CEO. And their conversation turned toward, are you having struggles with your employees finding childcare? Are you seeing more absenteeism? New parents not returning to the workforce? And as that conversation continued, we started discussing, all right, what can we do about this? And that started in late 2017, early 2018. And initially, we reached out to our school districts. We reached out to county government. We also tapped into a couple of the larger employers in Jackson County. And we started talking about what kind of things can we put in place. And the Seven Rivers Alliance, along with the Parenting Place in the La Crosse area, had done a childcare survey surrounding Jackson, Monroe, and Juneau County. And they looked at the availability of quality, affordable care in those 3 counties. And the results were really quite disheartening. Jackson County is a childcare desert, and that childcare desert is where for every regulated childcare slot, there are at least 3 children that need that slot. So our group, we continued to begin asking more and more people. As we started doing our work, it became apparent that we needed broader representation. And our task force today has grown to about 27 different community members. We also have Senator Jeff Schmidt, who represents Jackson County on our task force. And we also have Representative Nancy Vandermeer, who again represents parts of Jackson County, joining us on our task force. And that task force really is the advisory council to the work that we're doing. We started out then, we decided we needed to survey parents, caregivers of children that were working, and we wanted results simply for Jackson County. And so we just kind of did a grassroots survey monkey survey, and we leaned on our Chamber of Commerce, our little local newspaper that quite a few people in Jackson County read, and we put a link out for the community to help us with our survey. And we had about 140 responses on that real grassroots effort. We were really quite pleased with the results we had. And as the results came in, we learned quite a few things. There was definitely a lack of childcare. Families were on 2-year-plus waiting lists. Our families were just looking for any place to put their child. They were utilizing as many as 4 and 5 different, what they called providers, to watch their children. And when we looked at the productivity that was being lost in the workforce, it was astounding. and the Severn Rivers Alliance took our results and put some dollars to that. And we learned that there was over $2.5 million in lost productivity in the workforce in Jackson County. So while there are many reasons that we need to have more quality programming in Jackson County, such as, the child development and that sort of thing, we really leaned on that loss of productivity in the workforce to be kind of our leader as we went out into the greater community. And so once we started talking about these things, then more and more people started getting on board, and we have the area hospital is joined in, the manufacturers, the financial institutions, county government, school districts. We've really been able to grow the interest, and everybody has really come together nicely to look at what can we do through solutions. And the reason that we've been successful with that is because of the relationships that we have within our community. We all go to church together. We go to the ball games together. We see each other at the grocery store, and we're really a community that really comes together and really believes in doing what's right for our children.
Thank you so much, Marianne. Next, we have the privilege of hearing from Daria Hall, who's the Early Childhood Education Director at Milwaukee Succeeds. Daria, please share how the Milwaukee Ece Coalition highlights from your great work it has done so far and how it's led to a $7 million ARPA investment in childcare by the City Council.
Thanks, Paula, and good afternoon. So a little bit about Milwaukee Succeeds. We're a local collective impact partnership based at the Greater Milwaukee Foundation. And in my role as ECE Director, I get to co-lead our Milwaukee Ece Coalition. And that brings together home and center-based ECE providers, organizations that support early educators and families, mental health experts, and representatives from K-12, philanthropy, and local and state government. And we have two interconnected goals: to increase access to quality, affordable ECE for Milwaukee's Black and Brown families, and to improve the recruitment, retention, compensation, and professionalization of Milwaukee's ECE workforce. And we do that in a number of ways. We advocate with one voice to secure investment and equity advancing policy change. We center the expertise of Black and Brown people with lived experience in the ECE system. We use data to inform and evaluate our actions, and we communicate to decision makers, potential new allies, and the public about the importance of ECE and ways to support it. So with that context, I'll share a little bit about how the coalition came together and some of our actions so far. The current iteration of this coalition was born at the beginning of the pandemic, when then Mayor Tom Barrett called Ellen Gilligan, who's the head of the Greater Milwaukee Foundation, and said, we're going to need to bring folks together to support Milwaukee through this. And that was the beginning of what we called civic action teams. These are groups of stakeholders and community leaders that were actually focused on 6 areas: physical health, mental health, food, housing, K-12 education, and early childhood education. And our charge was really broad: basically identify needs, coordinate response, and advise philanthropy in the public sector on actions they could take. And Danae Davis, who's the executive director of Milwaukee Succeeds, and I were tapped to lead the ECE civic response team because we had relationships and prior work in ECE that we could build on. So we had a foundation, but I'll be really honest. In those early days of the pandemic, we barely knew which way was up, and we were just figuring it out, one day at a time, one meeting at a time. Our first year ended up being all about emergency response. So for example, we were hearing stories of early educators working all day and then spending all night on Amazon trying to buy bleach or gloves. So we worked with our local United Way and Childcare Resource and Referral Agency to set up a system for providers to request and get supplies. And we also knew that providers were really struggling financially with increased expenses and decreased revenue, and they were at risk of closing for good. So we worked with local and national philanthropy to raise funds for stabilization grants that went to 440 providers in predominantly Black and Brown communities that were being hardest hit by the pandemic. And these were, $2,500 flexible grants that could be used on anything: rent, mortgage, supplies, payroll, whatever you need. Got really positive response. And we're thrilled that 96% of the recipients remained open and serving kids. So we had some good early wins, but in 2021, we started having conversations about how this emergency response, it's vital, but it's not enough. We needed to start thinking about policy, including making sure that ECE is prioritized and how federal relief funds are allocated. And we identified the city of Milwaukee as one of our key advocacy targets, right? We knew that the city would be receiving just under $400 million from the American Rescue Plan. We knew that these funds would be targeted toward communities most impacted by the pandemic, toward advancing racial equity, and toward economic recovery, and that ECE was a strong fit for each of those criteria. And we also had a mayor who had expressed support in ECE. But we also knew that ECE isn't an area that the city had historically made big investments in. So we had to get very clear about what our ask was and how it would be implemented. And then when it came to the what, the message from providers in our coalition was crystal clear. We had to focus on staffing. I don't have to tell anyone here that staffing is a long-standing issue that had become a full-on crisis through the pandemic. Right? We had data showing that 75% of Milwaukee's ECE providers were reporting staffing shortages. And that was leading to closed classrooms, shortened hours, longer wait lists, and overall fewer children solved. So we went to work on developing a proposal for how the city could address the staffing crisis. And what we came up with was advocating for a $5 million investment to go into wage stipends that will be made available to every early educator in Milwaukee to increase compensation and retention, and $2 million for programs to strengthen and diversify the pipeline into the ECE workforce with a focus on getting men of color into the profession. And we knew that the proposal needed to be really airtight. So we spent a lot of time articulating the evidence base, putting together really well-defined cost figures and success measures. And then we took that proposal and we just did a whole lot of coordinated advocacy. We had coalition members participating in listening sessions, working with local media, doing targeted outreach to council members. There we had constituents of each alderperson who were equipped with talking points and district-specific data reaching out to their alders. And here I cannot stress enough how much it was the voices of ECE providers themselves that really made the difference. So I'll give an example. One of our coalition members is Proveedoras Unidas, which is a network of Latina family care providers. They got together one weekend in the computer lab of a local college to email their alderpersons and tell their stories. And when this proposal was being debated on the Common Council floor, the legislative sponsor specifically talked about these provider stories when she was making her case to her colleagues. And it was these stories that helped break through what was basically the single biggest point of pushback that we heard, which was essentially, why should the city be investing in ECE when we have so many other needs, right? The state and the schools are getting federal funds. Why us? And the coalition and the providers and their stories helped policymakers see that an investment in the ECE workforce is an investment in the city's economic recovery, right? It ensures that working families have access to childcare when they need it, and it gives young children that solid kind of academic, social, and developmental foundation. So we were really thrilled that the investment was improved, and we're committed to this being not just a one-off thing, but the beginning of sustained investment. So one of the things we're prioritizing now is evaluation of this investment so that we can have really solid and credible data that we can use both for continuous improvement and for more advocacy. And we're not just stopping with the city ARPA investment. You know, we have proposals into philanthropy and to the state to continue to build out the ECE workforce pipeline. And of course, we're excited to be an active member of Raising Wisconsin so that we can connect with communities across the state and work together on those state level systems and policies. So I hope that was a hopeful overview. And with that, I'll hand it back to Paula.
Thanks so much, Daria. We move now to Nina Hutton, who is the director of the Clubhouse Childcare Center in Amery, which is a small city of 2,900 in Polk County, which is in northwestern Wisconsin. Nina, you have a fairly different experience and have taken direction. Efforts that started in 2014, in which Fund $80 have been used as part of the solution. Tell us how the childcare conversation started and how it led to Amery and the Clubhouse Childcare Center to where it is today.
Hello, thank you. Yes, so Amery, you're right. Amery's journey began in the fall of 2014, as many rural school districts were experiencing declining enrollments. And so our school board wanted to take action, and our administrative team, they sent out a community survey. They wanted to know why were parents leaving, what were their needs, and what can the school district do to help? The biggest need was childcare, as we all know. You know, our rural community here in Polk County is also a childcare desert. And so many of the families were open enrolling their children in programs down in St. Croix County, if that was where they worked, or they were moving. And we also couldn't attract families to the area to work or live if they didn't have any care for their children. So the district had heard that Civic had a daycare in their school, and they went and visited, loved the idea, but they decided they wanted a little bit different idea. They wanted it to be very much a part of the school. And so they had this diapers to diploma mentality for the community here. And so in 2015, they used Fund $80, which is out of the school funding. Fund 80 is for community education projects. And so they used $60,000 from there for startup. I was hired, came on board in May of 2015. And by September 1st, we were open. I did not expect to be fully enrolled for maybe a year. We were full by November. And since November of 2015, I've had a 9-month to sometimes 12-month wait list here. And you know, other schools, we only levy $12,000 for Clubhouse. We run through a subset of Fund 80. It's Fund 85. And people have asked, well, how much funding is that actually of taxpayer money for childcare? It actually comes down to less than $1 a year per taxpayer. Other schools in the area who have visited our program and then modeled and built their own, some levy more money out of Fund 80. You know, we probably levy the least. So all of our payroll income, everything we do is through tuition. The community, I know, was probably a little skeptical at first about having childcare in their district, but the district has since, or the community has really embraced this idea of really that this is our young children are, you know, the ECE, making sure our families are all taken care of and their needs are met is everyone's responsibility. And so today, actually, there's a referendum vote for our district. And we are hoping that it passes, which will increase our capacity to take children. It would expand the childcare greatly, as well as making many much needed improvements to our aging buildings and systems, and upgrading safety and security. But what's been lovely to see is that our business community is so supportive, and is one of the driving forces behind wanting to expand our childcare. The pandemic really showed that without childcare, you don't have a workforce. The community has seen it impacts childcare impacts everyone. Even if you are retired, don't have a child in school or in early childcare, you don't have factory workers. You don't have someone bagging your groceries at the store. You may not have CNA care at the local nursing home if you don't have quality care for children. Everything's interconnected here. We have built great relationships even within the school district. We work very closely with early childhood, birth to 3 in the county. The classrooms come in, some of the second grade classrooms come in, read to the kids. It's just been wonderful to see. Every year we're adding new ideas, new community connections, and it's just heartening in this small rural community where we don't really have access to large group centers. Unfortunately, a lot of family childcares will start up and then they close within a year or so. Childcare isn't easy, but like many other places, we also face staffing shortages, and it's hard to recruit staff, but the district has been very supportive of that as well. And so maybe someday everyone will see our early childhood professionals as just educators, just as worthy and valuable as every teacher in every grade in the districts. So that is definitely my hope. That's our story here at Amery.
Thanks so much, Nina. That's our hope too, by the way. So we've heard some stories from rural Wisconsin, and we've also heard some stories from metropolitan Wisconsin. Lastly, we're going to hear from Tina Crave, who's the president and CEO of Greater Watertown Community Health Foundation. Watertown is a city with a population of roughly 24,000. It's 45 minutes east of Madison in Jefferson and Dodge counties. Tina, how did the region's childcare journey begin, and how did the coalition get to where it is today? What kind of results are you seeing?
Great. Thank you, Paula. I'm here today on behalf of Every Child Thrives, which is a partnership of about 50 organizations across Dodge and Jefferson County. We are also a collective impact type partnership, which means we work to align the limited resources of many organizations to a small number of goals. We use data to make decisions. And then we allocate some backbone resources just to coordinate our efforts and make sure we're working together in alignment. And our story began after a community health needs assessment in 2016. And I have to have a shout out to our early education professionals who were really the ones to help the rest of our community understand the importance of early childhood. And so that group at the time helped to raise awareness. We were showing the Raising of America documentary across our community. We had some speakers come in and talk about child development and how adversity affects development, especially the development of social and emotional skills, the life skills that are so needed in the workplace. And in doing so, our early educators helped create a shared understanding across the community in that the future prosperity of our community is really dependent on our ability to give our kids a great head start. So as I talk today, I want to share the progress that was made by our current early education providers, some potential new providers, and also employers. And so current providers started this work to improve access to quality care by focusing on the quality part. And they elected to invest in implementing the pyramid model which is a framework for promoting the social and emotional skills of young children. And that has been going well. I'll share results with that. But after a couple of years, we came together and said, wonderful, we're working to improve the quality of care. Now let's see what we can do to improve access to care. We know we're in a childcare desert. We have 3,000 slots for almost 11,000 children. We had a center serving 90 children in Watertown close. And our centers were telling us that they had classrooms they were unable to open because they were unable to staff them. But when we pulled this group together to talk about potential solutions, there wasn't any easy solution. And so that discussion paused for a year or so. At the same time as our community was learning about the importance of early childhood, we had numerous organizations, faith organizations and nonprofits that said, hey, maybe we should get into the childcare business. I think that fits in our mission, but we don't know how to get started. And so those organizations struggled a bit, not knowing how to get started. At the same time, in 2019, employers were starting to feel this workforce shortage. And so they embarked on a journey to find out, how many members of our community are not working but want to, and what are the barriers to them working. And they found out, there's 3 big barriers. It's health and mental health. Some families didn't have transportation, and childcare was the 3rd major barrier. And so they did a lot of great work on the transportation challenge and then wanted to start to work on childcare. And the more we tried to explore opportunities, it became really clear there's not an easy answer to this one. And we struggled a bit because we feel the biggest barrier is the ability to recruit and retain the early care workforce in rural communities. So then along came the pandemic, and never waste a good opportunity to create a sense of urgency. And so we capitalized on all the negatives that the pandemic brought and brought those groups together. And our momentum is really exciting and better than ever. All of our municipal leaders, our economic leaders, are hearing from businesses that the workforce shortage is their #1 priority. And they're hearing a readiness from businesses to get engaged. And so our coalition, the first and the most important thing that we have done is really create a common awareness across the community and help people understand, why is this a challenge and why will it take all of us to solve? And like Daria used the phrase, to advocate with one voice. And that's been our work as well. We have written talking points that describe how the current childcare system is not working for employers. It's not working for parents, it's not working for providers, and it's not working for children. And we have data to back up all of that, how it's too expensive for families. And I think the biggest learning that we all had was helping to understand the business model of childcare. And when families are paying an average of $11,000 a year, and that is 19% of their income, that's a significant, it's more than families can afford. But the true cost of care is closer to $16,000 or $20,000 a year. There's a gap. Our childcare providers will never be able to pay a fair wage and benefits if we can only rely on parents to be providing the revenue. So we've reached a point where we have a great sense of urgency. We have employers and nonprofits and at the table, municipalities willing to be part of the solution. So we've had 3 of our smaller communities commit ARPA dollars to this solutions. We have requests out to the counties, which have been received favorably, but we don't have results yet. We have 5 businesses who are ready to make a financial commitment to support access to childcare for their employees. What we don't yet have is the system to make that happen. And so where we're focusing over the next year is bringing the groups that were together in each of the small municipalities across our counties together to work as one. We have a committee of 15 representing employers, parents, providers, and other support agencies to really nail down the model for how can our employers contribute to this revenue model. And they gain by ensuring access to childcare slots so that employees can work. And we all gain by having children that can access high quality care. The one other piece that we started this summer was to engage WECA to provide startup business coaching for those faith organizations and nonprofits that were looking to get into childcare. And we have some good news there. One of the organizations is looking to open new services this summer. We have 2 others that are hoping to do so in 2023. They're working through the challenges of securing a space and then raising the capital to make that happen. We're very excited by the momentum that's in place, and we're also very excited to learn from all of you and how to make this new model work. So thank you.
Thanks so much, Tina. I actually think that's a great kicking off point. I am guessing everybody who's here listening today wants a tiny bit of advice. So I would love to hear from each of you, and we can go in the same order we did to begin with, starting with Marianne. What's the one biggest learning aha moment thing that either you learned because you did something wrong or you got it right the first time and that led to something that you know has been a big success for you, or that you know you would do differently next time?
So I'm reading a book right now called Ego is the Enemy. And in it, I always take copious notes, but it talks about how the more you learn, how, the more knowledge you gain, how much you learn what you don't know. And so for me, I think it was just realizing the vastness of support that's out there. I was going to Viterbo for my servant leadership master's program and was introduced to Kickapoo conversations through that class. And so I just decided, I'm going to go down to Westby one day. And I showed up, and someone had said, Ruth Schmidt knows a lot about childcare. So I made a beeline for, once I figured out who Ruth was, to be sure I talked to her. But the value of relationships with different people, and I think about all of the people that we've been introduced to as we go through this process. The other thing that I was pleasantly surprised with is the engagement of those lawmakers that we elect. So Jackson County is really kind of different, it's interesting. So there are 3 different assembly, people in the House of Representatives that represent Jackson County, and 3 different senators that represent different parts of Jackson County. So we couldn't just engage 1 or 2 people. We had to engage 6 of them. And we did that. And, we have them on our task force now and really contributing. And so I think my big aha, or the thing that I didn't realize, was how important just seeking out more information is and making those connections with other people.
Thanks, Marianne. Daria?
Yeah. So I think for us, it was incredibly important to have some early wins that helped us to, 1, kind of create momentum, to 2, prove to folks that this wasn't another conversation that was just going to stay a conversation. I think that we probably have all been a part of those where you might have the right folks in the room, but it doesn't necessarily go beyond that. And, the people who we convened were very, very clear that they don't have time for that. And they were going to dedicate their time and their expertise and their energy as long as we were making progress and getting results, but not any longer than that. which I think is completely fair. But that led us to really figuring out, okay, what are the steps that we can take now? And recognizing that, some of these early steps we're taking were not going to fundamentally change the entire system that we're operating within. We want to get there. That's the long-term goal, right? But we had a lot of conversations along the way around, well, couldn't we at least do this? Wouldn't it be better if we at least did this? And in having those kind of conversations and taking those kinds of incremental actions, we've built a lot of momentum and gotten kind of to a point where we can really start seriously having bigger conversations about, all right, what is this business model? What is this entire kind of policy infrastructure that we're operating within, and what kind of changes need to be in place? But I think that if we had started by trying to solve those, giant problems, we probably would have gotten stuck and wouldn't be kind of where we are now.
Thanks, Daria. Nina?
Yes, I would second a lot of what Marianne said about community building and reaching out and making those partnerships. I wish that I had reached out to our business leaders sooner. I didn't realize what a great support they were going to be for us. That has been kind of an eye-opening experience and wonderful to get some outside perspectives. And also, I wish that we could have maybe started a little slower. Opening, going from May to September was a little fast. And I think there was some bumps along the way. We had a high staff turnover to begin with. So I would say slow and steady is better than trying to jump ahead. Just make sure all your key pieces are in place. But I think one of the things I would really love to see happen is staff to be compensated, early childhood staff, with health and dental benefits and all of those things. I think we're working our way there here in this district. The pay scale is finally where it should be, which has been nice to see, but it's taken 6 years to get there. So yeah, that's our biggest challenge, is meeting the needs of staff and building more community relations.
Thank you, Nina. Tina?
Thank you. I would echo what Daria said, in that I think getting some quick wins are really important to establish credibility and help folks know that we're not just about talking, we're about moving from talk to action. And then I would say listening well so that you can speak the language, especially of those who control the resources we need to get to a different place. So I think understanding what was important to business leaders, understanding their frustrations, and then using that to be able to ask what they're willing to do to help be part of the solution.
Thanks, Tina. So I heard Daria speak on this and everybody a little bit, but as a early educator at heart myself, I want to ask each person, how do you involve the early childhood workforce in your communities, and how do they help shape the decisions you make? And we can, again, just go in order.
So in Jackson County, our providers are all part of our advisory group. And we also then actually created an organization, Jackson County Childcare Network. And that's the agency that's applying for grants, that sort of thing. And we've been sure to invite all of the providers. Now, we have 11 providers in Jackson County, so it's not like we have hundreds and hundreds of providers. We have 3 group centers and 8 licensed family providers in Jackson County. So we bring them all to the table, and we've gone out and visited them and had many conversations with them and involved them all along the way. and looking for innovative solutions to raising wages and finding ways to offer some benefits and making connections with them and for them. So.
Thanks, Marianne. And while there might only be 11, they are mighty.
They're fantastic.
Providers.
They are fantastic. That's right. That's
I
right.
agree. Daria?
Sure. So we intentionally kind of built the coalition from the beginning, centered around providers, both home and center-based, and making sure that we were kind of representing the kind of racial and linguistic diversity of Milwaukee in those kind of leaders who are representing and speaking around providers for the coalition. We also really made sure from the beginning to say, okay, what this means is we as a coalition are centering the expertise of providers and acting accordingly. So what that means, for example, philanthropy, is we're going to start by listening to what the providers have to say and then figure out what philanthropy can do, or figure out what our nonprofit sector can do, or figure out what our government partners can do, as opposed to those sectors kind of coming in and saying, here's our idea. Can some educators or some providers please validate that idea? Which I think is kind of something that has happened in the past. We wanted to be very intentional about not working that way, but saying our entire job is to figure out how do we leverage all of these different resources, capacities, skills to, respond to what the providers are telling us. And so I think, for example, about my job as listening to what the providers say, and then saying, all right, how do I build the agendas for a coalition appropriately? How do I make sure that we're sharing the right information? How do I make sure that whatever policy we're advocating for, or whatever, investment we're trying to secure, is really reflective of what providers are telling us? And my job is to, if I need to write a funding proposal, I'll do that, but it's not what I think, it's what the providers are telling us. And my job is just to do my very best to represent that on the page.
Awesome. Thanks, Daria. Nina?
Well, I'm fortunate that I get to work with my EC staff on a daily basis. But the district has really included them, which I am very proud of. I have staff who sit on the employee compensation committee. So our voices are heard. I participate in board meetings and get to do those things. And I've also mentored other districts that are looking at this model. I've had administrators come in, principals, directors, and shadowed me for a couple hours, and I make sure I share all of my handbooks, documents, ideas. It's not a competition. I want everyone to be successful in every district. So whatever I can do to help somebody else who is looking at wanting a childcare in their school district, I'm always more than willing to help out in any way I can. I've gone so far as to do site visits and give advice, which has been really awesome to get to see other childcares. So, yeah.
Thanks so much, Nina. And Tina.
Yeah, one of our overarching population level goals is increasing the number of children who are developmentally ready for kindergarten. And our early educators are, our community experts in that regard. So they really drove us identifying, what are the root causes behind our problem, and how can we as a community best support you and ultimately our children. Our providers have also done a wonderful job of sharing their personal experiences to help make the business case for why the industry is not sustainable over the long term, just operating on parent revenue. And so their willingness to help us educate the challenges in the industry and for parents has really helped to get our business leaders and our municipal leaders to understand the root causes that we're working against here.
Thanks, Tina. Marianne, you didn't get to mention this in your opening remarks, but I wondered if you would share just a few things about the local ARPA funding that Jackson County has secured for childcare providers.
Certainly. We went to our county and asked for ARPA funds to pay retention bonuses to childcare employees. And so they awarded us $105,000 of the $2 million in ARPA funds that they received. And we are going to be paying out quarterly bonuses to both full-time and part-time providers, whether you're working in a center or licensed family program. And so full-time employees are going to receive $500 a quarter, and part-time employees $250 a quarter. We also have additional funds in there to pay scholarship funds for startup costs for new providers, both licensed family certified providers as well as group centers. So we'll be putting those dollars right back into the hands of those people doing that awesome care that they're providing. So we're just finishing up our first quarter, and we'll be sending out checks to the providers by the end of April.
Congratulations, that's so exciting.
Thanks.
Nina, I've been wondering if you had any thoughts on particularly the Fund 80 approach. I know that there are a number of districts around the state that utilize that. Quick thoughts on sort of like pros and cons of utilizing that funding strategy?
One of the pros is it's meant for community use. So, and schools can decide how much to levy. And so how much community support there may be. But I would caution to make sure that they have that community support before deciding on a big Fund 80 levy. I know one district that has a levy of roughly $70,000 a year versus our $12,000. So it just depends on what the community is willing to support. But it's also a very nice, clean way. Like for us with our Fund 85, all tuition goes deposited into that account, payroll comes out of that account. So it's very separate from other district funds.
Thank you. Tina, you've been at this work for a while, and I'm wondering how you keep members engaged within your efforts.
I think it's keeping us all continually updated as to the needs, whether that be sharing what parents are telling us, what employers are telling us, what providers are telling us, what the educators are telling us about how children are doing. Keeping that information front and center, having conversations everywhere we are. So our partner agencies are expected to share this learning and information at their board meetings. We take it to our elected officials. So I think just keeping the conversation going and keeping it top of mind.
Thanks. And lastly, Daria, I was wondering if you would share a little bit more about the strategies you are growing to increase the pipeline of skilled workers coming into the early care and education workforce in Milwaukee.
Yeah, absolutely. So through the ARPA investment that we talked about, we were able to get funds for kind of 3 programs, 2 of which make available fellowships for young men of color who are potentially interested in going into early education classrooms, but would need kind of support, mentoring, coaching. And that is everything from the skills, right, of how to kind of, operate in this classroom to addressing some cultural barriers, right? We certainly know that we've had families express kind of discomfort with having young men in early education classrooms. How do you address that? How do you break that down and build those relationships with families? So we continue to work with Leading Men Fellows and Milwaukee Rising to build that pipeline. Also, are working with Milwaukee Area Technical College to launch an ECE dual enrollment program so that high school students in Milwaukee can take coursework and earn kind of credit toward early childhood credentialing while in high school, and increasing that exposure and knowledge of the system and how to get into this profession. So those are a couple or a few of the kind of discrete programs that we're working to get investment into. We also have heard, again, really loud and clear from the providers within our coalition that there just needs to be a lot more outreach to our public schools or all of our schools here in Milwaukee, and really helping students understand why they might want to consider going into ECE as a career path. And if they are interested, how do they go about doing it? Because it's not necessarily always clear, right? There are lots of different programs, there are lots of supports available, but it's not, something that everyone might be familiar with. So we have put together some funding proposals to try and actually build that kind of marketing and recruitment campaign to really answer those two questions. Why would I go into ECE, and how would I go about going into ECE, but do it in a way that is targeted to high school students. So, we're talking about TikTok videos and kind of social media, not long, PDF documents, right? Really making sure that we're doing this kind of in the languages that, students speak, that we have credible messengers. So for example, having leading men fellows who have just spent the last year in an early education classroom talking about their experience. So that's another thing that we're working on. And then we are in the process of applying for a state grant as well that would invest kind of significantly in building that pipeline, including by addressing all of these other kind of barriers that we know educators or candidates might come into. So they might want to be kind of pursuing their coursework, but get derailed because of food instability or transportation problems or housing, right? All of these things, real life happening. So we're putting together a proposal by which we would kind of bring in candidates, get them kind of accelerated earn as you learn coursework, and also, and really critically, address those wraparound needs to really support individuals so that they can stay on track and get their credentialing and kind of be hired, because we know that there is such a huge demand.
Thanks, Daria. Now I'm passing it back to Ruth to close us out.
Thank you, Paula. So I want to extend gratitude to our panelists for giving their time to share their stories, insights, and experiences. Feel free to share your reactions in the chat as well. I know some of you have throughout the presentation today. As we close today's session, we want to share the Raising Wisconsin website with you. Importantly, it's a place where you'll find resources for how to effectively advocate for childcare solutions. When you come to the website, be sure to sign up to get action alerts. And you can do that through under the Take Action section of the website. You'll also find a place where you can submit your stories and your experiences with childcare access and affordability. We encourage you to share and encourage others to share their experiences. It will help us elevate the experiences of residents across Wisconsin as we move forward. Please visit raisingwisconsin.org to explore all the site offers as an advocacy resource, and follow Raising Wisconsin on social media as well. Again, we thank you so much for attending today. And if you haven't already, go vote, and happy Week of the Young Child. Thank you.